Good. Good afternoon, everyone. Welcome. I'm Dean Van Galen, President of Missouri Southern State University, and I want to thank everyone for joining us for this virtual town hall meeting. I'm here with several colleagues, including our Provost, Dr. Paula Carson, our Vice President for Student Affairs, Darren Fullerton, our Director of Human Resources, Evan Jewsbury, and Julie Stamps, our Director of the Health Center. Thanks for being part of this town hall, and I also want to thank the campus for a very warm welcome over the last week. It's great to be at Missouri Southern. A little bit of context. I think you know that our university faces some very unprecedented challenges. If you look back to the founding of Joplin Junior College in 1937, there are some points in time that the university has faced really difficult times, and this is one of them. And it's going to be very important that we work together to get through this time. One of the elements that I think is special about Missouri Southern is the sense of community. And in the days and weeks ahead, we'll need to draw upon that sense of community to get through this difficult time. So today is the first of two town hall meetings. The topic is COVID-19, and the goal is to provide campus with an update of where we're at, as well as provide an opportunity to submit some questions and have some answers and conversation. The second town hall will be next week, which will be focused on the university budget and the challenges that we are facing. I think it's really important during these times to try to have good communication, engagement of the campus, to let people what's going on and just to be aware of some of the challenges that we face together. So again, thanks very much for being here. Today, I'm going to ask Vice President Darren Fullerton to begin and provide an update on the COVID-19 task force. I'm grateful for Darren and the 18-member task force for working on this very complex issue. So, Darren, if you could take it from here.
Okay. Thank you, Dr. Van Galen. As Dr. Van Galen said, we have an 18-member task force, and we say 18 plus because the deans are officially not members of this task force, but have joined us each week, as are other members of the committee. The task force charge was to discuss and document plans for face-to-face classes for Missouri Southern for the fall semester. And so this group is meeting weekly, usually for multiple hours. We had to cut it short today, but they are looking at things all across campus, from the academic endeavors in the classrooms to residence life, our international students. And so this group is really working to plan out how we will safely be able to conduct classes during the fall semester. Some of the things that you see on the board there, they're in the PowerPoint. The classroom environment, masks, social distancing, all of those things are relatively difficult for a large entity like Missouri Southern, and this group is taking that task on and working through these different steps or different accommodations to make sure that we can provide the safest possible environment for our students, faculty, and staff. Other items that the group will look at is how employees, students, and vendors or visitors can enhance this, because we all play a role in the safety of the people around us. And so every encounter we have with individuals on campus, we want to make sure that we are protecting ourselves as well as protecting others. COVID-19 policy. The campus is working on an overarching policy that we will roll out next week, and it's in several renditions that have gone back to the committee. This is the policy that we will look at, that we have been essentially operating on since Missouri Southern reopened our doors in May. We are following the CDC guidelines, the Center for Disease Control and Prevention, as well as the Joplin and Jasper County Health Departments, and any directives from the state of Missouri regarding to COVID and operations. And so that will be coming out for the campus to see, and will be posted online at our COVID-19 website on the web page. Other items for discussion that will be coming out and actually will be released later today is a mask policy. Effective next Monday, July the 13th, All students, faculty, staff, contractors, vendors, and visitors will be expected to wear a mask or face covering while on the Missouri Southern campus, including in the classrooms. Mask or face coverings are also expected to be worn in office spaces and/or in outdoor spaces where physical or social distancing is difficult to maintain. Again, this is for the safety and the best practices for our students, faculty, and staff. Wearing a face mask is not required in private offices when you're alone, in spaces where you do not need to worry about other individuals. There will be some exceptions to the policy. The policy has many carve-outs for folks that fall under the Centers for Disease Control guidelines, and so we want to make sure that those will be addressed in the policy and that those individuals will be represented as well. It is a lengthy policy, and so we won't bore you with all of the details today. It will be going out this afternoon for the campus distribution and distributed to a wider audience. Missouri Southern will be providing 2 cloth face masks that will have our logo appropriately on the front to students, faculty, and staff before the fall semester begins. Interim measures are being taken for the staff and students that are on campus this summer for the interim term. Beginning on Monday, July the 13th, any of the staff and/or student employees that are here for the summer that do not already have face coverings can stop by the Beimdick Recreation Center to pick up a couple different disposable surgical type masks to get them through until our face coverings are on campus. Some of the other discussions and things that are happening with that committee: preparations for the fall, masks we've already discussed, social distancing inside and outside of the classroom. And academics will have a long section. They are working with each individual faculty on each individual class to talk about social distancing and structure and those things. We also need students, faculty, and staff to consider social distancing in community and/or public spaces, in the Lion's Den, in our dining hall facilities, in lounges and facilities, in conference rooms. And so those need to be considered as well. Cleaning, sanitizing, and disinfecting. And we have to say thank you to our fantastic physical plant staff who are doing a great job of making sure that each area is getting cleaned, disinfected multiple times a day. In addition, we have over 200 hand sanitizing stations that have already been placed around campus, and more have been ordered for the fall semester. The custodial team continues to clean and disinfect. They are diligent, and we ask, many of the areas already have their own disinfectant for small community rooms, study rooms. So we ask you to please be diligent in cleaning up after yourself if you're in a room that is not regularly touched by the custodial staff. Academic class modifications, and I know Dr. Carson will address these later. Faculty are being asked to look at all options for their classes. We are looking at things from moving classes to larger venues, if possible, modifying or alternating student attendance in those classes. You'll hear terms like hybrid or HiFlex, which is a hybrid flexible model. And then some of our classes, as they always are traditionally online for the students that just cannot get to campus. So there will be a wide variety of academic accommodations happening in those classrooms, as well as the cleaning and disinfecting in those classrooms. We also have modified support services. As we did this past spring, things such as tutoring, advising, career services, counseling, Title IX, student support and assistance, our group MoSo Cares, all of those services have been able to be moving online to adapt to those students who cannot be with us in the fall, but then we will be here face-to-face for those students that are back on campus. Other items, the modified residence halls. We will be capping our occupancy in our traditional men's and women's halls, and then we will keep a minimum of one full apartment complex open for isolation and/or quarantine if that becomes necessary during the fall semester. We want to be able to have options for our students if and when the need arises. Another item on there is outside rentals. And so again, at this point, the university has chosen to hold all outside rentals to outside agencies through the fall semester, which would be to the end of December for this year. One of the things that we want to talk about is, just as we started with, to remind you that we all play a part in this. And so remember the things that we are advised by the Center for Disease Control. Wash our hands regularly with soap and water. Maintain at least 6 feet distance from individuals, especially if someone is coughing or sneezing. Avoid touching your face. Cover your mouth and nose. Stay home if you don't feel well. Refrain from smoking or other activities that may compromise someone's respiratory system. And practice that physical distancing. That seems to be the most important thing that we can stress to individuals. So again, we are a Lion family. We're proud to be the Lions, and we expect everyone to help us make this a safe environment for our students, faculty, and staff in the fall. With that, I would turn it back over to Dr. Van Galen.
I believe we'll open it up to questions. But before that, one comment, just to realize that every university is struggling with some very complex questions. We do not claim to have all the answers, but today we hope to share some information with you. Some of the questions will cause the task force to go back and give this some further thought and conversation, but we do want to share with you as best we can what we know, and I would ask Heather to go ahead and start with the questions.
Okay, wonderful. We will go ahead and continue discussing PPE and masks. That seems to be a very popular topic. So our first question will be for Evan. This individual says that they were talking with people and they're really concerned with having to wear a mask. Their position is physically active and are not able to be in a person's office that long throughout the day. So the issue is both with physical issues and manual labor and the heat, plus the person has respiratory illness. So what, if any, types of employees will be not required to wear a mask due to their physical activity, i.e. job requirements, and what accommodations will be given to those who find it difficult to breathe with the masks? Can a face shield be used instead of a mask? What will they be required to provide to get the accommodation?
That's a very good question. So we are purchasing face shields for all faculty. So for employees that have a situation like that, we would accept a note from their doctor or health professional that says that they cannot, or that their doctor would advise them not to wear a mask for health reasons. And that would be all we would need on our end. So, but it may be possible that we could get them a face shield if that was something that would work for them as well. So.
Okay, fantastic. Let's continue with another mask question. And this will be a two-parter, probably both to Paula and Evan, because it covers both the student gamut and the staff gamut. So what happens if a student refuses to wear a mask? Or an employee? How will this be enforced?
Yeah, so we expect the department chairs to help with faculty enforcement. We expect the staff supervisors to assist with that on the staff side. That's really kind of going to be the process moving forward, because it'll be a requirement for everyone, even visitors across campus. So, what are the repercussions? I know we were kind of talking about that from the student side earlier today, and I know we're still talking about that, but at this point, it's going to be a requirement once the policy comes out to campus.
So what precautions are being taken to ensure faculty are instructing in the safest environment possible, such as expectations for PPE? So Paula, do you want to take this one?
I sure do. So there are several things. First of all, with regard to faculty, we are introducing the mask requirement today, or the face covering. Let me not say mask, let me say face covering. I think it's a more appropriate term, since shields and other things can cover. So we are introducing that, and we have had a lot of discussion about, even if you're socially distanced in the classroom, are students still expected to wear the mask? And they are. So we are going to to require that. Now, the enforcement of that becomes a little bit more challenging, because if a student refuses, it essentially, we're hoping that there will be peer pressure from the students and positive influence and encouragement to try and entice every student in the classroom to wear the mask. If not, we'll have to maybe look at some other types of reinforcements. We've benchmarked a lot of different policies, and the ones that are out there basically say if a student refuses to do that, then they're turned over to discipline and possibly removed from the class. So we're hoping not to avoid that. But more generally, what we're doing with regard to making sure there's a safe return. Back in probably March or April, we asked all faculty to be prepared for 4 contingencies: at a start and finish face-to-face, start and finish online, start face-to-face and finish online, or start online and finish face-to-face, which is quite a burden. It's quite a challenge. We do recognize that, but things are so dynamic, they're just changing all the time. We don't know where we're going to be. Our current plan right now is to start face-to-face, respecting social distancing expectations. And so what that means is that we have asked all faculty, I just got to take this off because I can't talk with this. We have asked all faculty to actually begin August 1st when contracts resume for most 10-month faculty, and to have in place by August 7th an individualized plan we have developed, and it's going to be applicable across all colleges, a template. And the template will ask the faculty members to tell us, how do you think you can most effectively and safely teach, using what pedagogies, what accommodations, and what adaptations. And then that will be submitted to your department head and discussed with the dean, and we will keep those on file. We have basically said that we are amenable to adaptations of any form except the whole scale taking of face-to-face classes and putting them completely online. So what we have found to be the most popular and perhaps the most successful is what President Van Galen referred to earlier as some form of the high flex model, and that is where you take the entire class and you segment them into either 2 or 3 or maybe even smaller groups, and each of those groups has an opportunity to meet in person with the instructor, and the rest of the work is done online. It can be synchronous or asynchronous. It doesn't really matter, and obviously, just as we did in the spring, there's not going to be a one-size-fits-all. So we're asking the faculty members to consider your subject matter, consider your SLOs, and then tell us how you think this can best be accomplished. As you know, we have a different tuition structure. So students who plan to take online courses, start online, complete online, pay a different tuition rate than those. So there are, based on, we'll share this out a lot, based on the surveys, the numerous surveys and student input that we saw in the spring, we know that our students have a real desire to be back on campus, at least in some part and some time. It's not because they can't learn online, because they can. And our faculty can instruct very effectively online, but they need they miss the social interaction, the immediate feedback that comes from being able to inquire of an instructor and get feedback right in the very moment. So that is what we're looking for. There is no model that we will not consider except just the unilateral determination to take a class which is scheduled to be face-to-face and take it online, unless the university in its entirety has to reconsider policies based on the evolution. So we already have many of those things in place. We've already also relocated many classes. So if a faculty member says, I need to see every student, every class, then we have relocated them to larger classrooms. Brenda has worked on a diligent inventory, not just traditional classrooms, of which there's almost 200 normal classrooms we use, but non-traditional spaces, including spaces here in Billingsley where we could move classes for larger spaces. But also it's quite possible, as we start to see these plans, that we're going to have to perhaps move some smaller classes. If there's a 6-person class in an auditorium, we may have to move that 6-person class to a smaller venue than the auditorium so we can move students. So I think we're pretty prepared to know what our options are, our availability. Again, faculty just have to ask the department heads and deans if they really want to meet every student every time and not use some form of hybrid. So we're also looking at the arrows. I know that the efficacy of the arrows is questioned, but we're also looking at things like arrows or dedicated entrances and exits in certain buildings. Many cases, there's natural pathways that will make that pretty easy. We're looking at not moving furniture out of buildings because we don't want to see deterioration of our investment, but indicating with painter's tape or stickers or whatever where it is students can sit. We're looking at having the availability of cleaning solution, cleaning supplies in the classroom. That's another difficult discussion many have followed throughout the summer, and that is who cleans up. Well, we're not going to have enough physical plant staff to come every hour and 15 minutes or whatever it is and clean up in between. So we're going to have to ask faculty and students to take some responsibility for that, but we'll always have supplies there. Maybe some faculty members will not mind, maybe others would have concerns about that, but we'll have some way for students to be able to disinfect their areas before they use it, much like many other organizations are doing right now. So we're trying to contemplate everything about return to work. We want to make sure it's done safely, but we want to make sure that we're really providing to the students the learning and education that we promised, and deliberately considering how we can best accomplish the student learning objectives.
Great, thank you very much, Paula. We're going to ask just a few more about PPE real quick. This is actually a great question that came in, and will instructions be given on how to properly sanitize, clean cloth masks? That is definitely something we can do. Julie, do you want to speak to that?
Yes, the CDC has some wonderful video series that walk people through the steps of how to care for cloth face coverings. We have also decided as a university maybe to be able to do some of our own education. So I do think one of the approaches for beginning the successful start of our year is going to be focused on education.
Fantastic. And here is an additional one on masks, where there'll be additional masks available readily to faculty and offices to offer those who forget or don't have a mask but are willing to wear one if it's offered. How about you, Darren, on this one?
Yes, our goal is, we're working with our physical plant and with HR and the health center on having additional PPE on hand, because we know that even if we distribute masks to folks, that there will be some students or faculty staff, I put it in the wash and I've forgotten it. And so we will have some of the disposable masks available on campus to distribute in those cases.
Great. Now we're going to move over to a safety question. Will there be contact tracing on campus if someone contracts COVID-19? How will that work? Julie, do we want to, that might be a two-parter between you and Darren.
Okay, so one of the things that the task force is looking at is ways that we can help in contact tracing. With that, it has some personal responsibility. We're asking that students be aware of kind of making sure who they've been around. I have a nurse friend that honestly, she started a journal that lists where she's went throughout the community, because in 2 weeks, if you're contacted, you might not remember a week ago where you were at. So we're looking at different strategies of how we're going to be able to help with contact tracing. With us being in the city limits of Joplin, the health department is responsible to help with our contact tracing as well. So we're working together as a team to figure out effective ways to keep everyone safe.
And in addition, as Julie referenced the task force, the IT subcommittee of the task force is also looking at possible apps that are available that would assist us with contact tracing, as well as students being able to log their monitoring, whether they're taking temperature every day or those type of things.
Enforcement seems to be kind of a hot button topic on a few of both with PPE and just general restrictions. So this question is, who will be enforcing COVID-19 restrictions, and what will be the consequences of not following them? Darren, I don't know if that, or Dr. Van Galen? Evan? This
me,
is definitely a group question.
So,
Absolutely.
and we haven't fully discussed this yet, as I had said earlier, but we will definitely be following our progressive discipline policy, so verbal, written, suspension, termination. once we have a policy in place, it makes that a requirement. And when it's a requirement, we have to follow that policy. Otherwise, there's consequences, and that falls back to that policy. So obviously, I would hope that most folks would choose to wear a mask unless they have an accommodation that's needed.
So I would comment on that a little bit. You know, we're using the word required. I think that's appropriate. The word expectation kind of encapsulates culture. And I think we want to build a culture in which we expect these behaviors to protect ourselves and others. And I think as the students come back in the fall, that'll be really key to build a culture of expectation among the students. Yes, we're requiring some things, but to help people understand the why and you know, why this is important to not only protect yourself, but people you are in contact with, people who you may never meet, who you're helping to keep healthy by taking these actions.
We had a student sum it up this way. You know, it wasn't that many years ago that we allowed smoking on campus and moved to non-smoking. And you saw lots of people on campus smoking at that time. Do we still have people that will sneak a cigarette now and then? Yes, but the numbers have decreased. And so as Dr. Van Galen said, changing that culture and making sure that students, faculty, and staff understand the reason why we're doing this is to protect others as well as protecting ourselves, then that hopefully will bring us together as a group to do this without the punitive measures that people are thinking of.
Wonderful. Moving on to some logistical questions. I had a friend or family member who was possibly exposed to someone with COVID, and I was around my friend or family member. What should I do now about work?
One of the things I encourage every employee to look at, we have posted a sign and symptom checklist. So every individual, before you're coming to work, we ask you to check your temperature at home, run through the list, and then if you have specific questions of should you return to work yet or those types of things, give us a call. We also have a website set up. It's covid19hc@mssu.edu, and you're able to submit questions, and my staff check it several times a day so that we're able to respond and then help get your appropriate questions. Evan and I communicate several times a day so that we're able to make sure that everybody's taken care of.
Wonderful.
And Heather, part of that is also many of our students, faculty, and staff may not seek medical treatment on campus or may not contact human resources as their first call. So we do ask them, and that is on the COVID page and in the university's policy, even if you're seeking outside treatment at your home or community, please notify the health center, and if you are an employee, notify human resources so that we can be able to provide the resources and make arrangements for those people.
So looking at testing, will the health center provide testing, and will our insurance cover testing?
So the health center does have the capability. We've been testing since the end of May to test for COVID. There are some specific guidelines. We do have to be good stewards of the testing supplies that we have because one of the things that nationwide people will start realizing is there's not unlimited supplies. I'm not saying that we don't have adequate supplies, but we have to make sure that we're testing who needs to be tested when they need to be tested. And as far as the insurance goes, Evan has checked with the insurance, and if you have a physician's order, testing is covered.
Right.
For the employee side.
Yeah. So that would be through their typically like their primary care doctor's office, since the health center doesn't bill insurance.
Actually,
Or are you able to?
we don't bill insurance, but our lab specimens can be sent in with their insurance information. So I do have the capabilities to assist with that as well.
Perfect.
And we also still have local community testing sites. So I think at this point, except the weekends, there's really widely available testing in the Joplin community.
We'll move to a question about telework. There's been several questions that have come in about a telework policy and what that looks like for the fall. And then also, kind of another part to that would be the time off between when you're waiting to see if you've tested positive. So there's kind of two questions with that.
Yeah. So we'll take the second one first. The time, so sometimes you'll go get tested and it'll take 24 to 48 to 72 hours until you get those test results back. And that would be covered under the FFCRA as long as we have that documentation. So ultimately, we don't want you to come back, to work typically in most situations, especially if you've talked to the health center and we've deliberated that you need to stay obviously at home. Then that's what we want you to do. We can always get the paperwork later, but just keep in contact with our office so that we can get you the necessary paperwork that you need. So that is covered. The first part of that question is the university doesn't have a blanket telework policy. So what we have done is we've moved forward with the FFCRA allowing 2 weeks telework as an accommodation, but also 2 additional weeks if in the event they contract the virus. So you have a total of potentially 4 weeks there. FMLA is also another option, which is up to 12 weeks should you get the virus or have any other medical condition that you would need to file that paperwork with our office. And then there's the ADA, which we've had some accommodations, whether that be for face coverings or interim accommodations. It's very specific, so it's case-by-case basis, but we have had some accommodations to continue telework from home, at least for a few more weeks. And then we also have our longstanding leave of absence policy, which has been in the handbook for many years. And if you have depleted your vacation or sick leave accruals, then you could potentially apply for an unpaid leave of absence. So hopefully that answers the question.
There's also an additional question that maybe dovetails in that a little bit with holiday planning. Lots of universities are announcing that after the Thanksgiving holiday, that there be a possibility to moving classes online or working remotely. How would we be looking towards that? I think that's an Evan and a Paula question, maybe.
Yeah, I can start.
Yeah.
So obviously, we've spent a great deal of time benchmarking what other institutions are doing and recognize that that is something that is occurring, particularly in institutions where the students travel to attend school from far distant regions. It's interesting now, we used to think the dangerous areas were Florida or California or New York. Well, now we know we've emerged as an area as well. So sort of interesting because you could travel from Webb or Carl, and that's a risk as well. So we have looked at that many, many times. It's a couple of reasons that we haven't really done that, even though many other institutions have. First of all, we don't really know what the virus situation looks like at the end of November. It could be worse than Halloween than Thanksgiving. We don't really know that that's the case. And so I think much like we did with the spring, we're going to play that by ear and see how that goes. The other issue is that if you look at the portfolio of programs on our campus, we are a school that has a lot of different degree options where students really need to have an enriching capstone experience, a cumulative conclusion, a comprehensive final, things like that, where our students really are best served demonstrating their mastery of learning here on campus. So again, one of the hardest areas in health sciences and other programs where it requires interactivity amongst people completing the semester was the great challenge. And accrediting bodies haven't necessarily given us an exemption to not return to that at this particular point. So we think that the learning in most of our programs is going to be best accomplished in terms of ultimate assessment face-to-face for many, many of our programs. And so, well, that's not something Well, that's not something that we won't look at again right now. It seems to be that schools are moving more and more toward that based on a bandwagon effect, or sort of some previous stage viral models about where it is than what's really happening in the United States today.
I just want to reinforce exactly what the provost said. Great point. We don't know what the future looks like with the virus, and I think one of the keys is to doing what our faculty are doing now, which is building courses in a model that have some flexibility, because we don't know at what point, if there is a point, where we need to move towards more virtual learning. And based on what we know, I think we're preparing well, but there are a lot of uncertainties.
How or will the campus be notified if positive COVID-19 individuals have been on campus? If so, in what format? That might be a Darren and Julie question.
Okay. So I think there's probably some different avenues in that question. We will have results for the students or patients that I see at the health center that are processed through my lab and I have immediate access to. But if you have a student or visitor faculty member that receives services outside of campus, let's say a local emergency room, urgent care, I won't have that information quite as quickly. And that's where we really fall with the local health departments taking the lead for contact tracing. The state of Missouri has safeguards in place with labs. As far as the lab reports the result to the state, then the state is also aware of what area. So the city and county health departments work together with notification. And I know in a perfect system, everybody wants to know as soon as possible. But honestly, some of this does take time. And I think that's where the education component of social distancing, washing your hands, wearing a mask, and if you're ill, stay home, really become most important. But yes, there will be notification for contact tracing. And as far as every situation might be a little bit different.
And we really want to be careful because, again, this is health information and we need to protect the rights of these individuals. We also don't want to create a panic. We've had individuals that called that said, I was in the parking lot at Walmart with this person and they have been tested positive. That does not necessarily mean that I'm going to be told by the health department to quarantine or isolate. And so we want to make sure that we're not creating a panic by getting in front of the health department and giving information that the health department may come back when their research says you really weren't an exposure. So it is a difficult situation, but we'll try to keep the community informed as best we can.
And I would just refer to the frequently asked questions that are on our COVID website. That gives you a lot of great indications on what you should look for. This is a question that Evan and I were just talking about this morning. Will the students and faculty and staff members be required to wear a mask when exercising at the rec center? Evan, if you want to.
I don't know. Darren, this may be more your area. I'll let Darren take that one.
According to what we're seeing from our health professionals, if they are exercising, that is an exemption from the wearing of the mask. And again, many schools, we've seen schools that have gotten into, well, is this cardiovascular, is this not? If they are exercising, if someone is lifting weights, that's not a cardiovascular exercise, but again, they're laying down, they're breathing heavily, that's going to be restrictive. So right now, exercise is not considered to be one that would have to wear a mask.
Are there processes and procedures put in place in the health center, in the Wilcoxon, to take care of that, in the rec center, excuse me?
The health center staff have seen an initial draft of the policy, and they've been prepared to work with their staff on that and know what the expectations are.
So I'm going to try this one again. This is actually the one that Evan and I were talking
Okay.
about this morning. Will they provide signage on campus to alert guests of our new mask requirement?
Yeah, it's funny. We were just talking about that one. We talked about ordering, I don't know, probably around 200 or so little stickers for the doors that URM's drafting, and just basically saying that masks are required in this building. And maybe just leave it at that, or possibly add some more verbiage. See a staff member on campus if you're a visitor and need a mask. We've had other signage, though, that we've made over the summer through the Wellness Committee. Early on, we had URM help us with designing floor stickers at some of the entrances, so we've placed those in, I don't know, early June. And then we also had some posters made, staying 6 feet apart, practicing social distancing, virus prevention posters in bathrooms, things like that. So we've been working on a variety of different communications that we've put around campus.
This is another safety question. If my student becomes ill with COVID-19 and is a long distance from home, what help can the university offer? This pulls out of mama's heartstrings there.
Yeah, absolutely. Well, the first thing is we want them to connect with the health center. And we can't repeat enough, if a student is ill or a faculty staff member is ill, stay at home. Call and or email, whichever is most convenient for you, and reach out to the health center. Because again, they can walk you through. If we need testing, they can arrange for testing. We have students all semester long that are from a distance that will become ill, and the health center does a great job of working with them. We may have to get prescriptions for them, un-COVID related, non-COVID issues. And so, again, the health center will work with them. If they are on campus, housing has a plan. If, for chance, we do have to quarantine or isolate, we are keeping facilities available there. Fresh Ideas, our food service provider, is working with housing. They'll be providing meal delivery for those students so they won't have to leave their residence halls. And then we'll work out with them also if they need assistance picking up prescriptions and those type of things. We have support services there. Julie, anything I've missed?
Just two things I want to mention with that is the first one, have your student come prepared. One of the things I've been reminding students when they contact the office and say, I've got my immunization records submitted, I've got my medical history form, what else do I need to do? Pack a little health kit to keep in your room. A thermometer, some common over-the-counter medications, things that you might need so that you don't have a need to run out to Walmart. Right now, Walmart, our hours have been condensed,
Right.
so you can't really run out in the middle of the night and get a thermometer or something. So I want my students to be prepared. If you have health insurance, make sure that you have your health insurance card with you. So if you need help outside of our campus, then we're able to help you obtain help in an area that's covered by your insurance. And then the other thing I'd like to bring up is that communication piece. With COVID being more visible, sometimes our students and family members forget other things can happen. You can still have strep throat, you can still have the common flu, you can have a cough, you can have a cold. So we do want to make sure that people are getting appropriate health care when it could be something else as well. So just make sure that you remember that you have your student contact us so we can help them out.
But
think
I just wanted to add about students. Like Julie said, students get sick, so they may get sick with something or they may get sick with COVID. What we're doing right now is if a student has a certain vulnerability beforehand that's going to make it difficult for them to attend a socially distanced face-to-face class, we can work with them to get them in online sessions. We can ask them to visit Lori and disabilities to see what accommodations that they would need if they had any other compromised condition. If a student becomes sick during the course of the semester, we're going to handle it just like we would if a student had to have surgery or was unfortunately in an accident or the like. That's the plan right now. We have these processes in place. We have excused absences in place. We have options for students. Again, in the spring, I know that we asked people to complete students as much as you could and not to use eyes, but we do have incomplete options. We have other ways to complete students. And so now we're going to begin to, in the fall, handle student illness for COVID or whatever reason, just as we have always historically for decades handled student illnesses.
And Heather, with that, if a student is missing class for more than 2 days for any of health-related reasons, then they can reach out to the Student Affairs office, and we do notify the faculty and ask the faculty to work with them, and our faculty do a great job of doing that.
And same for faculty. We have faculty every semester that are not able to continue their duties and responsibilities during the course of the semester. So there are some universities that have asked every faculty member to pick a peer and completely be prepared to step in that class at a moment's notice, which is an overwhelming amount of work on top of an already overwhelming amount of work. So we did not do that. In the past, we've had faculty members had to leave for portions or the remainder of the semester. We've worked that out with colleagues or hiring adjuncts to come in and complete. So once again, we'll work that on a case-by-case basis if that should arise.
Great. We have about 15 minutes left, so we'll move into, there's a lot of questions about events for the fall. What those are going to look like, how will group activities on campus be handled, such as picnics, how will external groups be invited on campus, things, protocols that we're going to have in place, student leadership teams in respect to campus student events and such. Darren, do you want to take that question?
Sure, and many of those events may not have been finalized yet. I know someone had questioned Community Day, because that is a large, several thousand students out on the Oval with 125 to 130 vendors. Career Services, Alex Gandy and his shop are working right now on doing a virtual event for that. We don't know at this point how we could do a several thousand person event and social distance and maintain that safety feature for our students, faculty, staff. So this semester will look different. Smaller events, I know some of our registered student organizations are asking, can we even meet? And the answer to that is possibly, depending on the size of the group and where they meet, and can they social distance? If they can, we definitely want to accommodate that. I'm the advisor for the Student Senate, and we meet in this room. It's going to be very difficult for 24 students to social distance here. We're going to have to relocate somewhere else. So it depends on the event. Right now, as we said earlier, with facility rentals, we are not renting to outside groups. We are still, right now, we have not directed any university department to cancel an activity, but we are asking them to look and see, can you do that activity while maintaining the social distancing and the group requirements from the state and the city health departments. So any of the student groups or any faculty that advise groups, we encourage you to call Student Activities or the Student Affairs office, and we'll work with you on those areas and try to, we want as close to a normal experience for our students as we can get. But I think we all know that this is probably the new normal for the short term. And so we are going to have to be very flexible, and we ask people to be flexible with us, and we'll do what we can to support those. Picnics and things are still being decided. They're looking at some different models of maybe still doing a type of event, but structuring it a little differently.
So that kind of transitions into a few questions about sports and athletics. So what about camps on campus? Will those continue to happen this fall?
My understanding at PC last week, or on Mondays, excuse me, that camps were put on hold for the remainder of the summer. Some have happened this summer already, but because of the increase in the area, we were concerned about bringing students in for those camps, because the camps that are being conducted are high school and some elementary school students from all over the four-state area. And so we thought that that was safer to limit the camps for this summer and not have those going forward.
So what does sports look like in the fall? Do we have a plan for spectators at fall sports on campus requiring masks, social distancing? Will there be competitions?
As of right now, there will be competitions. The athletic department's not here, and I don't want to speak totally for them, but I know they have various plans that they are working on. There are several committees with the MIAA and the NCAA. They have reduced the number of contests, and so they have scaled back some of the scheduling and the contest of the and the travel for the different groups. They are looking at social distancing. I'm not sure at this point about the masks. Since we do have a mask policy, I would assume that that is going to still be into effect on campus. But they haven't finalized those yet. I think they're still waiting on guidance from the MIAA. But as of right now, they are still planning on having athletic competitions.
So with the requirement of student athletes after returning for participating in tournaments and or other athletic individuals working together, what types of precautions are being taken currently for those student athletes?
I know the athletic trainers at this point are looking at a variety of different policies. One of the problems that we're running into is nobody knows what 4 weeks is going to look like, let alone 8 or 12 weeks. So we have to remember that all of these policies will be flexible, looking at the situation that we're in at that moment. So again, I don't want to discourage people from thinking that we're not going to have a fun semester, but I also want people to be prepared. This semester is going to look different than past semesters. And the changes that we're making all are for safety of others and for our students.
And Heather, right now, when we have a few athletes on campus for the summer, every day they're coming into the athletic training department. They are having their temperatures taken, and they are basically asked those screening questions from the same question that we have and the CDC is recommending. And so they are doing a preliminary screening. They are trying to social distance in close quarters, such as the weight room and those type of things. And then, of course, the majority of the practices are occurring outside where they can try to social distance as well.
For travel this fall, what can we expect in regard to travel, both international travel and then just local travel with employees?
Yeah, travel is definitely one of those things that we've continually been looking at. So the CDC guidelines for international travel, I believe, are still the same as what they have been as far as international travel and recommending for quarantine. Is that correct, Julie?
Correct.
And cruises
So
as
the
well.
current CDC guideline is if you're traveling internationally upon return, it doesn't really select an area. It's that you will quarantine for 14 days once you return home. So I know that there's a lot of debate because I have people ask me all the time, well, that country I was coming from actually have a lower rate than what I'm coming back to. I understand that, but we also have guidelines that we follow from the Centers for Disease Control for best practices. And their current recommendation is if you've been traveling internationally that you quarantine for 14 days.
And Heather, for faculty and staff, I'm assuming that's what that is. The President's Cabinet still has to approve travel for whoever reports to that President Cabinet member. And so travel will be restricted just because we don't know what is going to be going on. There are certain things, and Dr. Carson can talk about, there are certain things that if it is required for accreditation or something that the university has previously mandated that someone go to for a certification or workshop, there will be some limited travel there, but most travel will be restricted. I know there was a study abroad question on there also, and that has been restricted for the fall as well. We just want to make sure, and again, as Dr. Van Galen said earlier, and Julie just reiterated, it's tough to have that crystal ball to determine what will happen 4 weeks, 6 weeks, 12 weeks out. And so we just want to make sure that we're taking those precautions.
What do employees need to look at about when traveling regionally, just to another state or other parts of the United States?
The CDC has a wonderful website that talks about travel within different states. I think initially they were able to identify some hotspots. The problem that has happened, though, is the virus is throughout most communities now. So there's risk related to travel to multiple regions at this point. Different states are taking different approaches. Some states are limiting or restricting travel to outside states. Missouri at this time has not done that, and they haven't from the beginning. So I always tell people I think it falls more back to personal responsibility. If I were traveling outside the area, I would check the area to see where I was traveling, the rates, knowing that if I did get sick, do I have the ability to take 2 weeks off to quarantine or be at home? And those are some difficult questions that people have to start asking themselves, especially when you work in limited size departments or if you have children that are in school districts and those types of things. So I think even though we still like to enjoy and see different parts of our nation, I think that travel needs to be at this time restricted for some people.
Well, we have just about 5 minutes left, so if people have other questions that weren't answered today or asked today, where could they submit those, or what should they do to get those questions answered?
And it really depends, I think, on what the questions are. I know you have the website, and you can give the link to the COVID task force question page. But if it's health-related, we want to keep those personal between the health center, and Julie can give you that email again.
It's COVID-HC19 or COVID-19HC@mssu.edu.
What we might be able to do is put both of
those
those
out.
at the top of the COVID website. That way people can access those individually. If they're employee-related questions, they would need to go to
Yep.
HR, though,
Yep.
I believe.
HR@mssu.edu. Yeah.
Reach out to HR, reach out, to that website, and that way we can make sure that we get your questions answered. So I think there's just a few minutes left. Dr. Van Galen, would you like to wrap us up?
Certainly. I want to thank everyone for participating today virtually. It's very important that we try to share information and work together as a community. I want to thank our panelists who were part of the conversation. We're all dealing with some very difficult and complicated issues with lots of unknowns. We're doing the best we can. And also, I do want to mention, thanks to the Board of Governors who formed a pandemic task force. And I can tell you they've taken a very strong and caring interest in the university and the challenges we face with COVID-19. So thanks also to the board. With that, thanks to Heather and your team for making this possible. And we will have a budget town hall meeting later next week, so I hope everyone can be part of that if possible as well. Thanks, everyone. Have a great day.